In 2015, world leaders committed to providing quality health services to everyone by 2030. We have less than 10 years to reach the goal of universal health coverage, and yet over half the world still lacks access to essential primary healthcare. As a consequence, 930 million people are at risk of falling into poverty due to out-of-pocket spending on their health needs. Digital technologies hold the potential of accelerating progress to health for all. Effectively deployed, digital technologies can strengthen health systems, support individuals to better manage their own health, and enhance the availability, accessibility, affordability, and quality of health services. Digital Health Week is a global moment to champion the role of digital health in universal health coverage. During Digital Health Week, organizations around the world are coming together to host events, make public commitments, and shine a light on the successes and challenges of digital health and UHC in their contexts. During Digital Health Week, civil society, private companies, government health ministries, and interested individuals are discussing the challenges and opportunities for digital health in their countries and regions. How far has digital health come? What barriers must still be overcome?
Good day to all of you. My name is Margot Kooijmans. I'm the head of the Philips Foundation. Welcome to our third webinar, where we want to share our learnings around providing access to quality healthcare to underserved communities. We're happy to be part of the Digital Health Week platform. Coming from a time where we did charitable donations, we have changed our way of working. Not only have we established the Philips Foundation Impact Investment Vehicle, where we issue loans and equity, but also we work with social entrepreneurs around the world in models for lasting change in healthcare strengthening. One of the models that you will recognize in their approach is what we call the wheel. And I'll go through the wheel really quickly to show you what we mean by this and how social entrepreneurs work in their ways of providing access to healthcare. Of course, they start with the impact they can make, the need that they see in their local environment. What is the lack or the gap in healthcare provision they see, and how can they tackle that? Of course, they have to be very aware of the local behaviors and ways of living. The solution has to be part and fit into that local environment. And then the affordability. Of course, we're talking about underserved communities, meaning that affordability is a huge part of the solution to provide lasting change. Operational staff. What we see is that in many cases, in many countries, low and middle income countries, medical staff is a challenge. It's lacking, or it's not that well trained. So part of the solution is also to see to the fact that medical support to the solution they try to provide is essential. The technical or digital solution itself, does it match the digital savviness of the local environment? Is there anyone that can operate the solution? How does it fit into workflows and all of that? All of that has to be tackled and has to be solved actually before it can work in a lasting way. Referral chain and supplies. A lot of the technologies detect or diagnose patients with a certain, to prevent a certain condition. But if they are diagnosed with a condition, where can you refer to? It's unethical to just diagnose and then having nobody or no one or not a higher level of care to refer to. So also the referral chain and drug supplies, for instance, have to be in place before healthcare strengthening can be sustainable. Who is the paying customer? Of course, we also have to talk about business models. Who will, in the end, bring money into the system? And we're not talking about high profits. We're talking about providing impact in a lasting way. So there has to be someone, be it the government, be it industries, or the patient themselves, supported by an insurance. But anybody, somebody has to pay or has to bring money into the system in order to make it last. And of course, there will be enablers and requirements like policies that do not allow midwives to make ultrasound scans, or other limitations that have to be addressed before a model can work. And then, of course, the go-to-market. It's very essential to think before you innovate, before a new solution is put into place, that there's also a clear way to bring it to the market, to the populations that need it most. So we have caught our learnings in this wheel, a brief summary on all the elements that have to be addressed before healthcare strengthening can be sustainable. You will recognize these elements in the ways of working of the interesting social entrepreneurs that we have invited today. And over to you, CK Andrade, our moderator.
Thank you so much, Margot. It is such a pleasure to be here. As we'll see on our next slide, today we're going to be tackling the reality that half the people in the world do not have full coverage of essential healthcare. And shockingly enough, almost 100 million people fall into extreme poverty from paying for their own healthcare. Now, if you take a look at this world map, you'll see that there are areas that are marked in lighter blue. This light blue represents the fact that they're underserved. And what this means, for example, is that 30% of the people in Latin America don't have access to quality care. Or we see that almost 30% of the people in sub-Saharan Africa are over 2 hours away from emergency care. And there's an impact to this, as we'll see on the next slide: mortality. In low and middle income countries, we see that more than 75% of the world's deaths from non-communicable diseases occur, and almost 95% of the maternal deaths of the entire world. I'm really honored to be part of Digital Health Week with this panel, and we're going to be being part of that conversation about how can we use digital health technologies to be able to improve access to care. Let's take a look at our next slide. Margot has reminded us of all of the elements that we need to attend to with our digital health technologies and how we approach access to care. What we'd like to do today is to bring some of these elements into a discussion with our panel. Let's take a look at the panel on the next slide. So we're going to be delving into this topic along 2 tracks. One track is going to be looking at how there are solutions that are improving care and referral outcomes. And then the other are going to be solutions around curating and providing information. And we're going to bring 5 esteemed social entrepreneurs who are using their solutions to be able to have an impact on access to care. Before I introduce them, I just want to remind you that today is a dialogue. If you have questions, please put them in the chat. Interact with us. We'd love to hear from you. And our speakers. First of all, Marcos Lacaya Bosch. He's the founder of Estación Vital. Marcos was educated and lived in the US, and he fell in love with using health technology to be able to improve healthcare in Nicaragua. And so he moved there. And fun fact about Marcos, he's also a volunteer firefighter. And then Nick Moons. Nick Moons is the director of Afia Pro Connected Care, and he's worked as a corporate strategist and a development economist around the world. And he loves working with people on the ground to be able to help to spur change in healthcare. And we're also going to hear from Rob Asiva. He is the founder of Penda Health. He is the Chief Product Officer of Panda Health. Instant promotion there, Rama. And his background is quite unique. He has worked and lived in the US, in India, and now he's in Africa. And he likes to bring all of those perspectives into his work at Panda Health. In our other group of social entrepreneurs, we have Claire Barnhorn. Claire is the founder and CEO of Salvaz. She began her humanitarian work at the age of 6, being concerned about world hunger. Another fun fact for today, the name Salvaz comes from Esperanto, and it means to resolve. And then we have Mohammed Delbai. He is the co-founder of Essential Medicine Guidance, and he's worked with Doctors Without Borders in many countries. And he's motivated by the realization that doctors often feel alone because they're asked to make big decisions, often without all the data at hand. There's our panel. And with that, let's go ahead and start the discussion today. I'd like to begin by introducing Marcos. Marcos, welcome.
Hi, CK. Thank you so much for having me. Thank you, Philips and Philips Foundation, for allowing us to be part of this incredible event.
So, Marcos, tell us a bit about the problem that you are seeing.
Sure. Well, obesity is the root cause of all health evils. We have seen all around us how it's affecting. It's actually the worst pandemic that we have seen in the last 50 years. Where does it start? Quite simple. Well, you know, the multinational companies, they advertise their products, usually high caloric and high fat products, with an emotional point of view, which creates an addiction among the population. And that has risen cardiometabolic syndrome, chronic non-communicable diseases, which means hypertension, diabetic, and of course, obesity. Just in the world, it affects 60% of the population. In Latin America, where I am working, it's way above average. Just the market, it's 400 million. And I will call, we are in the era of stress and obesity.
And that's quite a problem to tackle. Can you tell us a bit about the solution that you're offering, and what do you think makes it disruptive?
Sure. Well, the obesity, we find it's quite unique. We have created a platform that it's integrated both in an application and in kiosk where people change the internal dialogue. The healthcare platform allows you with nutritional and psychological tools to change the way you feel about yourself and the way you think about yourself. That way you reduce those needs to consume the high caloric and high fat products and high fat products. And next slide, please. What makes it unique and disruptive is that when you use the application, when you are helping yourself, you're actually paying for services that subsidize free clinics for the underserved communities in our region. And what's being offered in those kiosks? Well, preventive services, very similar to the ones in the application, that permits those who will not have access to constantly check their health from a nutritional and both emotional point of view. Now back to you, CK.
That is a powerful way of being able to use profit, income, to be able to have an impact. Thank you so much, Marcos. And now it's time for Nick. Welcome, Nick.
Thank you so much, CK. It's very nice to be here. The key problem we address is the affordable care. Affordable value-based care should be available at all levels. And that means that you have to connect the dots and that you have to avoid fragmentation and increase the performance, create trust. A digital tool is a powerful enabler to that end, but how to bring it to its maximum value? How can you answer the problems of Emmanuel, who is trying to manage his diabetes condition? Or for Vivian, who is too young and who already has a baby? Or Nancy, who's wrestling with problems of drug addiction, domestic violence? So the solution
that you are grappling with, the fragmentation of healthcare, is a universal problem. Tell me a bit about the solution that you're offering and how you think that's disruptive.
So the solution, digital tool is like Avia Pro, Connected Care, which is built on the Philips Vital Health platform. has many different modules and functionalities. So it's a one-stop solution for a health facility. The extension connected care refers to its high ability to link across the referral chain and to bring together multiple organizations and to integrate with other ecosystem players. In fact, a patient app, a professional app, the solution in the health facility itself are windows on one kind of platform. And so on one solution, and that's by definition means that you connect the care. So on the next slide, we see the 3 drivers to transform the healthcare workers and to make them local innovators. First, Afia Pro digital tool enables new practices and better clinical outcomes, such as through task shifting, protocolized care, decision support, telemedicine, remote care, and so on. A second driver is about the Afia Pro tool used for health financing. So how can you avoid unpaid claims, speed up claim processing, provide relevant data for the financing of health facilities and remote monitoring of those things? But the third, the social construction of change, that brings energy and makes local innovation really happen. So we developed the continuous improvement cycles as a methodology that allows health professionals and patients to build ownership. Ownership means the psychological connectedness and the willingness to change, and to facilitate that change management at individual and organizational level in order to initiate these cycles of improvement with clear and short-term goals. In this combination of technical and social, that is what makes change happen. Incremental change can lead to disruptive innovation to answer this challenge, and at the same time, it can lead to, or better even, to health system innovation. Mind, CK, there are many small steps that make a leap. Over to you, CK. Thank you.
Thank you so much. It's a complex problem, and that's quite the solution that you are throwing at it. And with that, we'll talk now with Rama. Rama, welcome.
Thank you so much, CK. Really excited to be here.
Oh, it's a pleasure having you. Tell me a bit about the problem that you are seeing and tackling.
Sure. So there is a dearth of well-qualified and good quality health providers in Kenya and across Africa in general. And as a result of that shortage, we often find that there is little incentive for health providers to innovate, to improve the quality of care, or to decrease cost, or to be patient-centered. And as a result of all of that, we find that there is low trust level of consumers with the healthcare system. And the healthcare could be very expensive or even non-existent. And very often we find that a healthcare consumer would go to a pharmacy, for an example, and try to seek medical advice. And that is the problem we are trying to solve.
And actually, when you think about it, not having trust in your healthcare providers is quite a problem. Tell me a bit about what you're doing to be able to address that, and why do you think it's disruptive?
So Penda Health has a network of 21 primary care clinics. It's a citywide network across Nairobi that serves 30,000 patients a month. And just last week, we hit our 1 million patient mark. And we are a highly tech-enabled solution provider. And as a result of our tech enablement, and as a result of the citywide network, and the good quality that we provide, we have one of the best patient experience scores in the industry, an NPS of over 70. So we diligently track the NPS, and we have really good results. And as, next slide. So coming to what exactly is very disruptive about our solution, it's actually incredibly hard to build a network, a citywide network of healthcare points. And we have done that at a very high level of quality, and we are able to scale that even beyond this city. So achieving that level of quality and scalability is what sets us apart. And to tell you a little bit about how we do that, we started about 3-4 years ago with providing a fully paperless based solution to our clinical providers. So we have an EMR when we track every data point that we encounter as part of the patient encounters. Now, going further than that, on top of the paperless system, we have built a clinical decision support system that helps the clinicians make decisions at the point of care and standardizes the decisions in a way that there is little variability among our providers. So it gives us the confidence in our quality to be able to scale really well. Apart from that, we have also integrated tools like WhatsApp with our EMR that gives an excellent patient experience. As a result, we achieve consistently high level of patient experience and trust. Over to you, CK.
And I'm thinking that consistency and the standardization and that high quality is something that many systems are striving for. So kudos to you on that. And now, Claire, welcome.
Thank you, CK. I'm very excited to be here today.
So tell us about the problem that you are tackling.
So yeah, this year alone, there's 235 million people who are in need of humanitarian assistance and protection. And in that space, there are currently 10 million NGOs globally that are operating, which consist of the fifth economy in the world. And all of these NGOs run their own procurement department and procurement processes, and that's the space we operate in. And as a fact, there is over 80% of NGOs that are local and national NGOs, and they have hardly access to funding because they lack procurement processes, lack procurement systems, and are not compliant to donor rules and regulations, transparency and accountability measures. And there's a dire need to reduce waste in our supply chains. We need to make sure we're buying the right things, we have access to the right people, we have more purchasing power. And on top of that, on the international NGOs, 2/3 of aid supplies are currently flying in from Western countries. So that's the space we're operating. We have to make sure we operate more efficient and effective.
It struck me that we don't often think about the supply chain. We tend to think about the delivery of care, and you've really pointed out the disparities in the supply chain. Now, tell me a bit about what you're doing to solve that, and how do you think that's disruptive?
So what we do with Solvos, we offer an open access catalog with solutions integrated with an e-procurement workflow. And why we're disrupting is that we're offering procurement as a service. So there's no need to have your own department, or we can support your department. And with that, we can empower people who currently don't have access to funding or cannot run their own tenders because they don't have an auditable tender process. There's a lack of information on suppliers, on specifications of products, services, etc. So basically, Solvos offers you a consultant on your shoulder with open access knowledge. We have a technical procurement officer for those that are into procurement. They know the concept of tactical procurement, but we're helping NGOs to buy what they need and providing decision-making tools. With that, we have a shared and managed database of suppliers and a curated supplier and tender process. So we can really do a match between what do you need, what is the complete package, what is a fit for purpose solution, and we can make the bridge between the NGOs and the suppliers, and on an open access catalog. And I'm very much looking forward to discuss more later on because I know time is short. Over to you, Sai.
Procurement as a service, and also thanks for unpacking the complexity of what's happening in the supply chain. And now for our last introduction in that realm of curating and providing information. Mohammed, welcome.
Thanks, Mansika. Good to be here.
Tell us about the problem that you are tackling.
So the problem of EU guidance is really, on the one hand, looking at healthcare workers, making sure that they can access medicines information on a daily basis, making sure that they understand what medicines are available for them. And really the big problem there is medication errors. Sometimes as high as 50% according to the WHO. And with that, you have a massive medicine spend that is close to 20% of your total healthcare spend, around $200 billion. And on the other side, it's really within the pharmaceutical companies to be able to help them transparently and ethically engage and educate healthcare workers and support healthcare workers at the point of care.
For me, when I think about medication, I've never thought about the local aspects and the recognition that you may not have the same formulation in the other country. Tell me a bit about what you're doing to be able to solve that, and how do you feel that it's disruptive?
So, excellent point. I think that the recognition of that generic information is just not enough for a local healthcare worker to make a good decision for their patients. And I think one of the disruptive elements is really looking at localized medicines information and making sure that the healthcare workers have the right information at the point of care to make that decision for their patients. I think the other element, if you think about the next slide, for a disruptive solution is really looking at that business model, making sure that you can have a sustainable business model that drives your impact across the different countries. And, we started out as an NGO. We were constrained by lots of small little projects tailored to the needs of the funders, and we couldn't really get the resources to be able to build out the longer term vision. About 5 years ago, we actually converted into a for-profit company. We were able to raise a lot more money and actually allowed us to step back, think about the platform, and really build the right solution that we needed. And so far we've now become the largest medicines platform within South Africa. We see over 1 million searches per month on the platform, and that kind of building has allowed us to expand and localize that medicines information now into 6 additional countries. And as with Claire, I'm really looking forward to the discussion as we come on to it.
Thank you so much, Mohammed. And we're definitely going to bring up that concept of the business model later, because I've always thought nonprofit equals good, profit equals bad. And the realization is sometimes profit actually allows you to be sustainable and do good. And with that, let's, now that we've done the intros, let's start our first panel. I'd like to invite Claire up to join us. And now we're going to focus on those solutions around information sharing and curation. So what's the first question? The term social entrepreneur was new to me. Claire, can you tell us a bit about how you distinguish between what you do as a social entrepreneur and the work of a commercial entrepreneur? For example, someone in Silicon Valley.
So for me, I share a similar background as Mohammed. I worked for years with Doctors Without Borders as well. And if I explain my work these days, I'm a humanitarian with a business model. That's how I explain social entrepreneurship for today.
Humanitarian with a business model. I love that. Mohammed, tune in on that one. What are your thoughts?
Yeah, I mean, I think Claire has really kind of highlighted that perfectly. I think for me, it's the selection of the problem. All entrepreneurs solve a problem for someone. I think for a social entrepreneur, it's the selection of the problem and who are you actually solving for? And for me, that's the key difference.
And again, bringing in that humanitarian bent, how do you prioritize? Who do you solve a problem for? And in this case, targeting it towards access to care. On that note, with access to care, and both of you, all of our panelists are working in that realm of low to middle income countries. What is different for you about developing and delivering your digital innovation within that space? Mohammed, why don't you give that one a go?
So, I think it links into the previous kind of conversation that we had, really around, it's about the ability to choose who you're trying to solve the problem for. Within middle to low income countries, the healthcare system is structured differently. And understanding where you are saving costs or driving revenue and for which stakeholder that becomes applicable is really the big difference for me. And making sure that you understand that ecosystem and understand how that money flows and how the problem fits into the solution.
And when you talk about finding your place in the ecosystem, one of the things that I found overwhelming is that the problem is vast. So how do you find your space? How do you pick that humanitarian focus? How do you prioritize in the midst of that much to do, Mohammed? And I'd like you to keep that in mind as well, Claire.
Yeah. So again, I think it's like you said, there's so many problems in this space. It's really understanding what expertise you have and what niche you can tackle. I think trying to say I'm going to solve it completely for everybody doesn't make sense. It's understanding that ecosystem, the niche within the ecosystem, and kind of bringing the value that you have that nobody else has to that problem and solving it accordingly.
Knowing your core competence. Claire, what would you like to add to that, especially since you're looking at supply chain, which is not quite as tapped as some of the other areas to work in?
Now, what we did is, like, I come from a Unitarian background, and I just want to solve and make sure that we're addressing and supporting more people than we can. Needs are rising, and funding is not going up as fast as the needs. So we just have to be more efficient, and that's how we looked at it. And I think technology has never been more ready. And we all work digitally, especially over the last 2 years. We all know that digital work is more or less normal. And how we looked at it is we just looked at the largest cost component, which is 65% of expenditure of aid agencies is in procurement. So that's why we start focusing on this in this space. So just tackling and seeing where we can make the biggest impact and provide value. As part of this whole thing is to empower local responders, going back to the wheel of Margot earlier on. We have to empower local responders with capacity, and this is the capacity that we like to offer.
And there's a theme that I'm hearing, local, from both of you, local information, local capacity, and really being able to tap into the wealth and the relevance of the information for your particular sector in low and middle income countries. Too often we think, oh yes, we look to the West, or we look to the higher income countries. Now, business model keeps coming up, right? So let's just talk about that business model. Starting with you, Claire, how is the business aspects of what you do affecting the success and the impact of what you can do with Solvez?
Yeah, so we have a dual thing. We have a freemium model, which means it's open access knowledge. So the whole knowledge component of our platform is open access and free. So making sure that we provide value for planning as well as preparing. And then our business model is a SaaS model. It's a basic subscription as a service, as we all use probably digital technologies. Yeah, that's our model. And the more people who are using our platform, the more richer it will become. Both on the knowledge side, we provide open access consultancies, but also volunteers all over the world to provide support, share their expertise to support others.
So they're being able to leverage some of these innovative cloud-based business models like SaaS, and being able to parachute that into your context. Mohammed, you raised that question about being able to how you take that profit to be able to do good. Let's talk a bit about those business aspects for you. I thought it was really powerful when you talked about your shift to profit and how it freed you up. How did you come to make that decision, and what is that impact of your business aspect on the impact that you can have for your customers?
So, I think the biggest impact that it has made was allowed us to take that step back and fundamentally invest in the platform as a whole, to really kind of look at solving that medicines problem that we were trying to solve. Before it was, piecemeal, a little bit here, a little bit there. But I think that was one of the biggest elements for us, a turning point around 5 years ago. And, at the moment, we're a two-sided platform and it's a SaaS business model. But fundamentally, without good revenues, you cannot scale impact. So, like grant funding can only get you so far. So from a social entrepreneurship perspective, you have to think about how do you make this not only sustainable, but profitable, so you can continue making impact and actually build on the impact that you have created already.
And you just raised that key piece that to have impact, you must be sustainable. That you must be able to have a business model that allows you to persist and to be able to continue to provide your service. We talked both of you about what you're seeing as success and what your key driver is. So let's switch gears a teeny bit and talk about the benefits. So if we broaden the scope a teeny bit and think about digital health as a whole, what concrete benefits do you think your customers and people in low and middle income countries can derive from digital health innovation in general? What do you think digital health has to offer? Let's go ahead and start with you, Claire.
I think, it's lots. And I think that to have access to more affordable and open access knowledge, I think that is critical. So that we don't rely on consultants, we don't rely on a huge organization, but that you have access to this knowledge. And I think digital and technology has made that more possible than ever. And just assuring that there's better fitting support, making sure you leverage on the latest technology, even though if it's only a piece of paper normally flying around, you don't need all the encyclopedias any longer. Everything is available digitally.
Thank you. And, I was just thinking, you talked about access to knowledge, and that's a theme for both of you. And we've all talked about access to care, and yet underpinning all of that is the access to knowledge. And for you, Mohammed, what are the concrete benefits that you think digital health brings to folks in low and middle income countries?
So, again, I mean, I think Clay took the words out of my mouth. It's really around access. And you've picked up on that as well. It's the ability for healthcare workers, for patients to be able to access the right information at the right time. And again, we have this massive amount of access nowadays, and making sure that the right people get that information is important. And that then can allow them to act on that information. So, and by default, have that ability to change healthcare outcomes for individuals on the ground.
And what I'm hearing are so many parallels in what we're doing in higher income countries. I think about Philips, and with our Health Suite platform, we talk about being able to bring actionable insights, to be able to bring the right information to the right people at the right time through interoperability. And again, it's the very same principles. What strikes me is the difference in how you choose where you apply the technology and the insights, and how you bring that to everyone. Thank you so much, both of you, for sharing those insights. And now we're going to switch panels and talk to our guests who have solutions that are based around improving care and referral outcomes. So welcome back, Nick and Marcos and Rama.
Thanks, CK.
I'm going to switch the order up a teeny bit and start with that question about what's different in developing and delivery of your digital innovation within a low and middle income country, as opposed to what you might have done in a higher income country. So let's go ahead and kick that off with you, Rama.
Sure. So one aspect about low and middle income countries markets is that very often there isn't an early adopter market for innovations, or it's fairly thin market. So the best starting point for digital innovation is often technology that's already being used by your target customers. And you would want to build incremental innovations on top of that. For example, if your customer base is using feature phones, you would want to start with USSD. Now, in our case, we realized that to bring in a better patient experience and to have our patients interact with us digitally, a lot of them already have WhatsApp. And so our initial innovations are focused on integrating WhatsApp into the patient journey, and in integrating WhatsApp to our EMR and innovations. We actually got fairly quick adoption of our innovation. For example, the first 3 months of introducing WhatsApp, we had 3,000 users talking to us in a month. The other aspect, I would say, of middle countries, that offline is equally important. If your offline is really strong, that's when online tends to work as well. So our physical network of medical centers becomes really important for us to do any sort of digital innovation and be able to serve our customers better.
And so it's great. So what I'm seeing here was a really novel way of tapping into what is available, what are people already using WhatsApp, rather than trying to bring in more cumbersome technologies and insert them into a space. And so pushing that question over to you then, Marcos, what do you find different about the development and delivery of your solution in Nicaragua compared to what you'd be doing in the US?
Well, we find that the ecosystem is quite unique. If we look at it from a social point of view, the need is higher. The impact is going to be way higher. So we're going to definitely change people's lives on a broader spectrum. But the reality is also it's a very complex environment. You see, we might have political barriers. due to governmental instability, or perhaps the legislations, the banking legislations, might not permit or support entrepreneurs in our environment. That is why here in Estación Vital, we have become quite flexible or learned the idea of pivoting, of understanding the problems that we might have can be adjusted to different environments in different arenas. That's why we combine in Estación Vital both an application that is payable and something that is free for those who might not have access to care. But we learned that from a very unique ecosystem.
And you are really highlighting that flexibility, right? The need to be able to pivot as your world changes, because it is a bit more fluctuating. Although there are days where I think that the whole world is fluctuating, and so I think that we are all learning to pivot a whole lot more than we ever did before, right? I yearn for the old days of stability. So Nick, from your point of view, and you've seen development and delivery of tech in many countries, what do you see is the difference of developing and delivering Afia Pro in a low middle income country as opposed to a higher income country?
Thanks, CK. I think already one of the points mentioned by Rama, in that the purchasing power is different. Also, the appreciation. People do appreciate, first of all, value for money, of course, but the time span is very short. So what they want to have is low-cost solutions, and there is little emphasis for the total cost of the solution and the quality it takes. So I think that's one. Secondly, you have a lot of fragmentation ongoing. You have a lot of lack of trust ongoing. And so these are the key elements to cope with. At the same time, the kind of innovation you like to bring has to be strong enough to really, in this small market, to build up something. So I think these are the key kind of challenges, so that you have to attune your innovation and the way it suits all the needs of all the people. Your customers has to be in such a way that you can really make them local innovators, and that's a different context and a different ball game altogether if you bring back all these factors together.
Yeah, you've actually raised a whole lot of points in that minute or half, Nick. But a couple of things really stood out. One, when you talked about your innovation has to be strong enough to have impact. I think that in many places, I've worked in Silicon Valley, and you have got the option to do something that may not be so strong, but it'll have a little niche because you've got money and a market and people have money. And so that concept of you've got to have innovation that's strong. The other piece that you brought out that really struck home for me was about helping people, boots on the ground, become innovators. So really fostering local innovation and building that, as well as tapping into the strengths of what is happening in your space. Now, this brings us all back to that different lens that you are thinking about technology and the world from as social entrepreneurs. So I'm going to go back to that question about social entrepreneurship. Rama, as a social entrepreneur, how do you see what you're doing as different from, or maybe you don't, as from a commercial entrepreneur?
Sure. So for me, the element of social entrepreneurship actually comes from the space that you're operating in. So the customer segment that you're going after. And that segment for me either has a market failure, so certain type of services are not available, or there's a public services delivery failure. So when you get into that space and you try to solve problems, it's very different from what you would do in a developed market with a high income base. That's one critical element of social entrepreneurship. In the case of Penda, we operate in Nairobi, largely in lower income neighborhoods where most of our customers do not have a health cover. So 75% of them actually come and pay cash for our services. So they're getting access to something that they didn't have before. The other element of social entrepreneurship that is different from, say, commercial entrepreneurship is your willingness to stick with it. Like Penda has been around for 9 years, and the initial years were spent figuring things out. And it's only in the last 3 to 4 years we've really started scaling up. And we are still not done. There's a whole of Africa to cover. So that commitment to stay with the problem till it's solved is another element of social entrepreneurship. You're not going in there thinking, I want a 3 or a 5 year exit, and then I'll drive a Mercedes or something like that.
Do you know, you raise an excellent point there, the point about longevity and how long the ramp up is. So I remember my Silicon Valley days where the goal was, how fast can we get to IPO? Now, keep in mind that to have an innovation that sticks, there actually is a long trajectory. But here, I think that the piece that you're really stressing is the longevity, the willingness to stick in there until you get impact, that it isn't about, okay, my target is IPO, and then off we go. Marcos, I'm going to pop that over to you now.
We see, I think a social entrepreneur is someone that sees the deliverables and the impact quite differently. I think we are looking at first the impact that we create to improve humanity, and on the side also the business aspect. So it's the way we see the problem, it's quite unique. It's not about profitability, which usually a commercial entrepreneur might see the tackling a profit issue or an access on that aspect. We see it the humanitarian aspect to it. Also, the investment methodology is quite different. You see, you have to get involved with investors and organizations that are more involved on the impact side as well as the economical side. So it varies also the ecosystem that you work with to improve your business. And finally, I see that the synergy to integrate business and impact is also quite unique. We see that here in Estación Vital, it's about finding models to support those who might not be able to pay for something with incomes of those who might have to be able to pay for something little. So it's the combination of integrating business models and technology that is being already used.
Thank you so much. And now I'm going to queue up a couple questions from the audience. Nick, because there's been a question targeted to you, you talked about the health funding benefits of your solution. So the audience member mentioned, I can see gains for claim management, but you also mentioned remote monitoring of finances. Could you elaborate a bit on that?
Yes, definitely. So one of the key issues you have is, like I mentioned in the beginning, it's about trust. And how can you establish trust within the this economic and this health transaction, if I can put it like that? So one of the ways you have in Afia Pro that all the data is really very well secured and accountable and timestamped. That allows to, on one hand, in the preparation of the loan requests, to have very clear demands for it. And once the moment the loan has been disbursed, you can really say follow it and remotely monitor it properly. And I think that are additional benefits that help very much, that instill trust of the financiers into the health sector, because health sector has a big, to move, the health sector really needs money. And investments, and and one of the key points is that that the trust is lacking to create it. In this way, you can create that transparency.
Great, thank you so much, Nick. And I hope that clarifies for the member of the audience. And Marcos, a question for you. Could you explain further how you use the app to generate cash for the kiosks? Is that through advertising? That was a question from the audience.
Sure. We have so the application, once you download it, you will get a freemium access. The beginning of it, it's being able to meet the team through chat and different tools, and through the app, which means it's actually a coach that is assisting you through the way. It's a health coach. At the same time, you have different free services, psychological, both nutritional. And once you're ready to engage a little further, you will pay for the services, for being able to pay for having not only a console, but also a plan that is intended to holistically change the way you feel and think about yourself, that has both nutritional and psychological tool. That income that we generate through the application permit us install very inexpensive, actually very rentable kiosks in locations where they are highly populated, such as we install it actually in the Walmart here in Nicaragua. Walmart in Nicaragua, it's actually a very multidisciplinary area for visiting, even in shopping malls. We put it in different areas where people might use it. So it's one sustaining the other. That's how we make it work.
Great, thank you so much. And I love that model. And Ram, I want to come back to you with a question. We've talked a lot about the specific benefits, the various solutions. And I just want to, again, zoom out a teeny bit. And if you look at health tech as a whole for access to care in low and middle income countries, what concrete benefits do you think that health tech can bring to low and middle income countries in general?
Sure. So one critical aspect is lowering costs. And to give you an example, when we build our clinical decision support for our clinicians, what that does is it standardizes care, and it prevents us from hiring a lot of quality managers for our clinics. So we are able to offer, by the use of that technology, offer lower pricing for our products and services. Apart from that, we are also seeing that consumers are looking to use digital in a similar way that they are using other services in other industries. For example, when they go to a travel portal, they are able to look at the options, look at the choices, think about what they want and make decisions. And healthcare has traditionally lacked that kind of transparency. So we are able to bring that to them through digital health. And there are a ton of such examples where consumers find it more convenient if they can just talk to a doctor over a video and get a prescription in certain cases. So yeah.
Couple really nice insights there. I think that the one part was about all the ways in which you have to lower cost. And I was just thinking about all those folks who are paying cash. And if you're paying cash in a low middle income country, then really you need to be able to bring your offering into what's affordable for them. But I see an irony, because at the same time, there are high expectations for digital because people are used to consuming digital through other services, whether it's their YouTube or whatever on their phones. And so you've got to be able to have that balance between, I've got to keep the cost low, and also consumers have expectations. So thank you so much for this round of panelists. And now let's go ahead and bring everyone back up. And we've got a couple questions for Claire and Mohammed, and then we're going to do our question for the entire group. So let's start with Claire. How do you balance profit for the greater good?
Yeah, for us, I think I explained already. For me, I see myself as a humanitarian with a business model, which makes I have to make Solvos sustainable and a self-rolling mechanism. And any profit we have, we put back into our knowledge base. We expand our catalog, we expand our technology, and we're just making sure that the service we provide is extended. So we putting any profit back into our organization to provide more value.
And that really fits in with that humanitarian focus, that you put the money that you get goes back into providing more services. Similar also to Marcos and to everyone else. And Mohammed, do you want to add anything to that before we go to our close down question?
No, I think it's also just that selection of the problem. If you're solving a meaningful problem and you can generate profit, fundamentally it's making sure that profit then goes back into solving that problem even better. And that is a lot of what the social entrepreneurs across the panel are actually doing. It's making sure that the problem is big enough and making sure that when they have that extra profit, they basically feeding it back in to ensure the solving of that problem.
And you raise a really good idea there, making sure the problem is big enough. And then going back to Nick, you make sure that the innovation is strong enough. And so, wow, that's a lot to do. So now I'm going to kind of start bringing us to closure with a question that flips the lens a bit from the way that we're used to thinking. Typically, folks think about how higher income countries can teach folks in low and middle income countries how to use health tech. What I'd like to ask now is, what do you think people can learn? Those people in the higher income countries, what do you think they can learn from the models that we have for delivering access to care through health tech in low to middle income countries? And I'm going to start with you, Rama.
Sure. So one aspect of healthcare in higher income countries is the necessity to reduce bloat, which is now becoming apparent. So the desire to reduce costs and still preserve clinical value. But for lower income countries, it's a question of survival. You have to do it up front. If not, your business will just not take off. And for example, innovations like task shifting. How do we move tasks from a clinician to a nurse, from a doctor to a nurse, is one example. So these sort of innovations are more apparent, more visible in lower income settings. And I think higher income countries can really learn from that.
Great, thanks so much. Really being able to identify some of these key innovations that become more apparent because of the space that you're in. Nick, what are your thoughts? One thing that higher income countries can learn from our advances in low and middle income countries?
I think the original thinking, because in the end, if you look into, say, in the more prosperous countries, if I may put it like that, the space to develop is much more limited. You have much more space here. And then also the type of steps people are willing to make are sometimes very amazing. And PESA came from Kenya, didn't came from Holland. Yeah? So you have a number of big differences here. And though the market might not be so big in low and middle income countries, the opportunities are large. So models are developed that are very well replicable. And that show certain leaps in thinking. For example, also the way in how to bring the whole complexity of decision making, task shifting, a nurse who is able in Sierra Leone to do complex operations, surgery, because he's specially trained on that aspect, is not very common in the European space. And these are exactly things, local kind of innovations you can enable if you bring digital power together with the social construction of it, and you translate it into a value proposition. Even when it is tiny, it might have a big amplification if you apply it on a larger scale. So,
wow, Nick, so you gave me 5 instead of 1. So let me try to see if I can wrap them all together. I think that what you've really highlighted is a broader canvas for innovation, the ability to leapfrog technology, and then really to be able to try things out, which we might not be able to do in a higher income country. So, Mohammed.
Yeah, I think Nick's still one of my ones.
Oh, no, bummer.
For me, I think it's, if you take a step back, a lot of the healthcare systems in, high-income countries are very developed, and there's a term called technical debt that countries in low to the middle-income areas will not have. So we have the ability to leapfrog technologies and to try different things, because you don't have a legacy system that you have to try and integrate with. And I think that's one of the things. So the business models are a little different, but the nice thing is that when you see that it can work in a different location, you could then go, you could make the case for breaking down those legacy systems and for trying to clear technical debt in a higher income country.
I love what you mentioned about technical debt and not being strapped with legacy. So much of our work, so much of my work focuses on helping people move their legacy, for example, to the cloud. And I'm just thinking, not having legacy kind of is a luxury. It frees you up to do other things, and it allows you to pivot. And, Marcus, you were one of the people that talked about pivoting. And so if you can give me the one thing that you think that higher income countries can learn from doing tech and delivering access to care in low to middle income countries.
Well, I think you mentioned it. You literally read my mind. I think it's the capability. In our environment, we were somehow encouraged, if not forced, to really adapt to a very challenging environment, to an ecosystem that provides a lot of not gonna say difficulties, but definitely challenging that encourage you to pivot quickly. And that mentality, I think it's something that anybody who wants to become an entrepreneur needs to adapt and be and feel comfortable with the uncertainty, with the idea of making mistakes and adapting, making mistakes and adapting. In this ecosystem environment, that's exactly how we are succeeding. It's adapting, changing, and converting to an environment that permits us improve people's lives and make profit also, so we can continue improve people's lives.
And really emphasizing the ability, we talk about the fail fast, fail often, and being able to adapt, and you really are forced to do that there. And Claire, I'm going to give you the final word on this one. You're one.
Then I'll do a little bit of provocative note here. And I think that we can learn in the West that we're not all as unique. I think we all think we have to develop our own technologies. And what we can learn is that service models work actually very well. And we see that the scale you can reach with actually looking more at the service model instead of developing everything in your own little company or as big the company might be, but it's more the leveraging of what's out there and look at things more as a service instead of buying or setting up everything yourself.
Thank you. And then thinking about the ecosystem and leveraging that ecosystem. And with that, wow, thank you so much, all of you, for sharing your insights, and to our audience for your participation. You can see that all of us have come back to say thank you. As we close out the year, as well as this webinar, we'd just like to thank everyone for supporting Philips Foundation, for supporting access to care, and for making care possible around the globe. If you can, stay tuned for our upcoming webinar on access to cardiac care. And with that, thank you all, and all the best for the holiday season.
Bye.
Bye, everyone. Thanks for joining.
Bye.
Thanks. Bye-bye.
Sou hipertensa, né, diabética, né, tenho problemas também, risco de infarto, artrose cervical.
O maior obstáculo que eles têm, eu acredito que seja o diagnóstico da doença. Eles moram em zonas rurais e às vezes não conseguem vir até a cidade.
A SOS Brasil é uma organização social, sem fins lucrativos. A gente olha para soluções replicáveis e escaláveis de impacto e transformação da saúde brasileira. A gente tem hoje na América Latina dados como o fato de que 30% da população não acessa serviços básicos de saúde.
Eu fico até emocionada porque eu esperava realmente que todo ser humano tivesse condição de ter um acesso à saúde especializada no Brasil.